Sir?
Oh, I just wanted to comment that when they wrote this law, they exempted members of Congress and their staffs, and they also exempted Harry Reid's entire state.
They're going to mention that state of Nevada. And all the unions that also pushed for it got exemptions.
Yeah.
You want to give the microphone? Great. If it was such a great law, you think Congress would be fighting the way to get in. And I wish they would get rid of Congress's private pension system, which is phenomenal. Put them in Social Security, and I wish they'd put them in Medicare, and then you could see some changes.
It's the IPAB, which I believe is Independent Payment Advisory Board. Is that correct?
Oh, yeah,
We're coming to that.
We'll get into that a little bit. We have a whole section on that. That's going to be.
Should I wait on my question?
No, you can ask us.
All right, because it's been floated around, so I'm not sure everyone is aware of the power that this committee will hold. These are 15 unelected officials who will make recommendations on cost cutting for Medicare. And they will have these in place by August of every year. And if Congress doesn't act on their recommendations or come up with alternatives for cost cutting, their recommendations become law. So they circumvent Congress in a kind of sneaky way, in my opinion. And I also want to point out that by Obamacare's terms, Congress can repeal IPAB only during a 7-month window in the year 2017. And then only by 3/5 majorities in both chambers. After that, the law precludes Congress from ever altering IPAB's proposals. Now this is built into Obamacare. And I just want to point out that when President Obama in Denver in the debate said that IPAB can't make decisions about what treatments are given, I'm just curious how he can make that statement. Because that is the actual purpose of this committee of unelected technocrats, to do precisely that. And I think it's a misrepresentation of that committee to the American people.
I just love that when you talk dirty to me. I love when people are informed like that. We're actually going to go over that exact stuff. It's amazing. And there's probably going to be no doctors and nurses. Now, one thing about this whole Obamacare, there were no doctors and nurses having input into it. The trial lawyers had plenty of input. There's no tort reform in here. And if a state even tries to have some tort reform, they're penalized. Now, I'm an obstetrician gynecologist. Anybody want to guess, like, let's say for Connecticut, what would be sort of an average cost for the malpractice insurance each year?
$250,000.
Well, unfortunately, not that much. That's more like Long Island, about 100 to 120,000. Now, I would say in the last 17 years, we've been cut to maybe about a third of what we used to make, maybe 40%. I ran into a general surgeon friend of mine, been in practice about 30 years in Danbury, and he's the best. I mean, I went to him myself, and he was making less than a third he used to make. And it was 1 o'clock in the afternoon, I see him at the bank, and he said, yeah, I got no patience. You know, it's tough. And the other thing is, with the economy so hard, colonoscopies, 500,000 colonoscopies didn't get done last year because the people couldn't afford the $300 copay. I mean, it's just hard times. Any other questions right now? Sir, ma'am.
Am I correct that I read that the average age for a woman with breast cancer is 68? 68.
Yeah, I'm not sure. I know every year of your life there's more risk. And Angie, let's go to 5 because that's going to deal with what you've been touched on and with what she's touching on. We can go to maybe to 3 minutes of 5. Yeah, that's good stuff.
Would have decreased the number of screening mammograms by 60 to 75.
Doctor?
Let's go to 240 on that one. Yes, ma'am. Sir.
Would you just explain to them the purpose of the U.S. Preventive Task Force?
Other government-appointed workers that serve on.
She's actually going to do that.
Okay, all right.
Yeah, otherwise she probably knows better.
Screening guidelines from 2009. So those were developed by what is called a U.S. Preventive Services Task Force. This is a committee of government-appointed bureaucrats, not practicing physicians. Now, they may be insurance carriers, public health officials, other government-appointed workers that serve on these task forces. So, under the Patient Protection and Affordable Care Act, PPACA, it specifically directs the president. Oh, that was interesting. Why does the president really needs to get involved in this? And the Secretary of Health and Human Services, currently Kathleen Sebelius, who's a lawyer, not a physician, to develop outcome and measurement criteria for all providers for any given program or medical condition. In other words, the President and the Secretary of Health and Human Services are going to take it upon themselves to develop guidelines for doctors and patients to use to diagnose and treat any given medical condition. Gosh, they must be really good. This U.S. Preventive Services Task Force, there can be all kinds of different ones set up. So depending on what the disease or the medical condition is, they'll set up a different task force for that. So in 2009, here's an example of what the task force came up with. Mammography screening guidelines that essentially put us 15 years backwards in screening mammography. It would have decreased the number of screening mammograms by 60 to 75%. Now, this is at the same time that we have studies coming out of Sweden and Norway, as well as the US, that say that screening mammography has decreased mortality from breast cancer in women by at least 30%. Wow, how did they do that? Well, part of how they did it is they ignored these studies. They chose the studies they wanted to use, they ignored other ones, they came up with their own computer models. So this is what we can expect. Now, what's the point of decreasing screening mammography? To save money. It saves a lot of money not to do screening mammograms on women between 40 and 50, to only do them every other year between 50 and 75, and then not to do them after that. So you're going to tell a 75-year-old woman, gosh, I'm sorry, we're not going to do a mammogram on you anymore. It's just not worth it. So we know it saves lives, they just
I thought we had to stop here for a second because this is so important. I just want to tell you what I always did. I can't really give you a scientific thing for this, but at 35 I would get the first mammogram. I just didn't want something to sit in there. Go ahead.
They won't let you.
I know.
I didn't have health insurance for a while, and I wanted to get one because one of my best friends was diagnosed with breast cancer at 32.
Yeah.
And my gyno said they will not do a mammogram. Even if I paid, they said they won't because you have no risk factor.
Yeah, usually I can call a place and they're friends of mine and probably take care of his wife and get them to do it. Now remember, 3% of breast cancer is under age 30. It's not just an older person's disease. At Danbury Hospital, we had a 24-year-old pass away from breast cancer. And I think I've heard of an 18-year-old. I don't know about that one myself personally or anything. But what I used to do was at 30, just always, for years and years, 35 I'd get just kind of a screening one. At 38 I'd get another. And then at 40, I would follow American Cancer Society recommendations of every year, as long as the lady wants them. But now officially, the American Cancer Society is going to say, as long as she's in good health. I kind of like that last part, because you're giving them an excuse to say no. We found so many, I found hundreds of breast cancers over the years, and we find them so early. A lot of times when they're little specks of calcium, sometimes they have to put a needle in by the calcium to try to find them. But what they're doing is so wrong, so that they're not going to get them until 50, and then it's every other year from 50 to 75, and then at 75 they say to the lady, go home, Now, I got to give all these people some credit. One of the problems we have in this country is if you have a man and a woman who's 60, they're trying. I think we just don't agree with their approach, but I do give them credit for trying. A man and a woman who retired at 65 have put about $40,000 into Medicare, the average couple. They will take out about $240,000, and the numbers aren't working for our kids. So, I don't want to just sound like we're all negative about this. At least they're making an attempt. I think it's a very wrong attempt. And they didn't have doctors and nurses and healthcare people involved with this. They had lawyers and bureaucrats and, pharmacies and things involved. But, questions? Yes?
She had a question.
Sorry.
Just two points. By not pre-testing at the right time, the mammogram, whatever.